Overview of a protocol for malaria case and the focus. You can foresee notification, investigation, classification, and the response. Outlines: introduction, household census and the mapping, case investigation, focus, investigation, data management. Introduction: elimination, accounting for each and every case and managing case appropriately is a necessity. Notification, investigation, classification, and response on other cases and the foresee are to be done. The protocol guides health workers in notification, investigation, classification, and response of case and the foresee and in archiving and managing data and information. Accordingly, it incorporates guidance on how, when, by whom, etc., and some important formats to be used for notification, investigation, classification, and response. Household census and mapping. Household, in shortly, HH, census of all Kabyle is very crucial for case investigation purpose. The main reason is to obtain population and housing counts for Kabyles or local communities, which is crucially important for locating an index case and neighborhoods. A well-done census provides most accurate data on households and the population in a given Kabyle. Thus, the enumerator's role is of critically important. Household census and mapping. A. Who will do household census? Health extension workers with support from PHCU or World Office will be enumerators for their respective Kabyles. The advantage of using health extension workers for household census: they are knowledgeable about their Kabyles and expected to establish accurate data and information. They have an acceptance by their respective communities. Using health extension workers reduce cost. Household census and mapping. B. What are an enumerator's responsibilities? Recording and housing units and residents in a specific geographic area. They do not omit a person who should be counted. Do not include persons who do not qualify as residents. Keep the information confidential. C. Whom to enumerate. All men, women, and children are included. Household members temporarily absent on business, traveling, or in the hospital for a short stay includes newborn babies born on the census date, maid servants who sleep in the house, college or boarding school students living in your area while attending school in your area, farm or construction workers living in your area while working in the area with no usual residence in another place. D. Whom to exclude. Persons temporarily visiting with the household and have a usual place of residence elsewhere. College students, school work teachers, and other professionals who are on vacation or are spending the weekend at their parents home. Person employed by the household, example, keepers, daily laborers, but not sleeping in the same house. Person who were formerly member of the household, but have since become residents in other places, in which they may remain for a long time. Household census and mapping. E. What format to be used? Form 1. Enumeration sheet. Name enumerator or health extension worker dash date of census dash. The table or format is first column Warda, second column Kabale, name of householders, third column family size or residents, fourth column GPS coordinate, fifth column divided into two, latitude and longitude column. Case investigation, CI and classification. Case investigation includes detection, notification, investigation, classification, response. Purpose. The purpose of case investigation is to investigate and classify each malaria case and institute appropriate response measures that halt transmission. A. Where and when to do case investigation. In areas eligible for elimination, when the number of cases become manageable, 1 to 5 cases per week in a PHCU. That means 1 case per health post per week. Notification within 24 hours and investigation within 3 days. B. How to notify cases. Health worker who diagnoses the case should notify to PHCU or World Health Office focal person within 24 hours. PHCU focal person has to notify respective health posts on case reported through health centers and hospitals. Health extension workers should report the case or cases or detected to their respective PHCUs within 24 hours. PHCU surveillance focal person in turn compiles and reports to Warada Malaria focal person. The same information should be reported to higher levels. That means zone, region, and federal. C. Who will conduct case investigation? Health extension worker assisted by PHCU or Warada Malaria surveillance focal person. Capacity of the case investigation teams unit built so this is operationally feasible and conducted within 3 days. They do not have to rely on the zone or region teams for case investigation, classification, response. E. How to conduct case investigation. Case investigation will be done within 72 hours by health extension worker following an index case. Health extension locates an index case household. List neighborhoods within 17-meter radius. Do blood testing by RDT if positive to determine parasite species. Standard operating procedure will discussed in detail. E. How to classify cases. Classification based on origin of infection. This means locally acquired case, imported case, induced case. Locally acquired case means acquired within the area of investigation due to mosquito-borne transmission. Imported case acquired outside the area where it is diagnosed due to mosquito-borne transmission. Induced case, a case whose origin can be traced to a blood transfusion or other form of parenteral inoculation of the parasite. Case investigation and classification. F. What format to be used? Malaria case investigation classification response form. Monthly summary report of case investigation classification response form. Standard operative will be discussed in detail. Force investigation and the classification. Focus. Focus is defined as area containing epidemiological and ecological factors necessary for malaria transmission. It is categorized into three. One, active ongoing transmission, where locally acquired cases have been detected within the current calendar year. Residual non-active transmission interrupted recently 1 to 3 years. The last locally acquired case was detected in the previous 1 to 3 years. Clarity. Focus. No local transmission for more than 3 years. The purpose of focus investigation is to identify the main feature of an area and inform actions. Force investigation and the classification. A. When to conduct force investigation. Force investigation is done once a case of locally acquired malaria has been detected. It should be done within 7 days. Who will conduct force investigation? Team of people, health extension workers, PHC surveillance, vocal person, or environmental health practitioners. C. How to conduct the force investigation. Collect the basic information, name of a focus or hand village, Kabale, town, Warada, zone, etc. Describe the locality, environment, example, urban, rural, altitude, main, geographical feature, indigenous population, vulnerable population, migrant, etc. Map the focus, location, nearby households and health facilities, access route, etc. Force investigation classification definition. Active force means ongoing transmission. Operational criteria. Locally acquired cases have been detected with the current calendar year. Residual non-active transmission. The definition is transmission interrupted recently 1 to 3 years. Operational criteria is the last locally acquired case was detected during the previous 1 to 3 years. Clearly force. No local transmission for more than 3 years is definition. The operational criteria is there was no local acquired case for more than 3 years. E. What response measures? For active forcing, high coverage of appropriate vector control. Active case detection at appropriate interval. For residual non-active forcing, active case detection in targeted areas. Suspected people should be screened and managed. For clear forcing, passive case detection to rapidly identify suspected malaria and determine whether a local transmission has been established. F. Which format to be used? Force investigation and response format is usable. Monthly summary report of force investigation and response form are usable. The force register should be maintained and the change in the force type should be updated on a yearly basis. Documentation and data management. Complete and timely malaria data as well as proper documentation of information highly needed in the elimination setting. Case and force investigation response. Activities will be documented on register standardized by the national program. Validation of completeness and the quality of data should be done regularly and documented properly. Assessment is regular and random on data to be done at all levels by focal person to identify where operational or quality gaps may exist. Data management. Which data? All patients tested with patients, demographic data, types of testing, and the result of testing, and other basic clinical data. Report on case and focus. Investigation, classification, response. Case follow-up, treatment outcome, survey and assessment findings, supervision findings. Additionally, all register and formats should be properly maintained at all levels. What level? Archiving data and information will take place at all relevant levels of the health system. That means from health policy to Federal Ministry of Health purpose. Data and information could be accessed for internal verification studies and the preparation of the consolidated country reports, and the latter on for acquiring certification of malaria free status by WHO. Thank you.